Hello, welcome back. The topic today is about cancer stomach. So, am I a candidate or am I a high risk candidate for a cancer stomach? That's the topic because most of the people who come to us for the ulcer or stomach pain, they are worried about cancer. So, they keep on asking the question, say, could it be cancer stomach? So, this is the one which is really worried. So, we are talking today, the topic is the risk factors, or am I a candidate, a high risk candidate for a cancer stomach? That's the topic. Okay, so we have a food pipe, stomach, and small intestine. Stomach, the main purpose of the stomach is to digestion. So it churns the food and absorbs the food. So cancer can happen. This is one of the very important or most common cancer in the body. So, suppose who are the high risk candidates? Now, suppose you are above 45 to 50 years of age. So, age itself is a high risk for any cancer and particularly cancer stomach. Number one. Number two, you have a genetic predisposition. Suppose you have a father, mother, or first degree relatives having cancer stomach or any GI gastrointestinal stomach, and you are in a little higher risk group. Smoking and alcohol. All smokers or anyone who uses tobacco, three times they have high risk for the cancer stomach. Alcohol, same. So both combined, smoking and alcohol, the chances are very high. Obesity nowadays, this is a very is an emerging risk factor. Obesity, sedentary lifestyles, and very importantly, chronic atrophic gastritis because of H. pylori infection. These are the factors. Or suppose you have an environment factors. Suppose somebody is working in chemical factories for prolonged. These are all high risk factors. Okay, what are the signs and symptoms which we can think about? Okay, am I a high risk candidate for a cancer stomach? First and foremost, usually cancer starts as a small wound or maybe ulcer. So the signs and symptoms of ulcer, like pain in the abdomen, nausea, vomiting, yearly fullness, satiety, bloated feel, all these things. Suppose you have these things for a prolonged period, and if your age is more than 45, and if you have the high risk factors like smoking, alcohol, obesity, family members having cancer stomach, then we have to think little deeper. So first is it presents as a ulcer like signs and symptoms. The second, stomach pain, the pain. The next is they have a kind of bleeding sometimes happens. So inside the tumor, when it bleeds, they may have a blood vomiting, or the black color motion, that's called melena, black tarry stool, we call that, coffee ground colored, black starry stool. Weight loss, unintentional weight loss, this is very important. Unintentional weight loss more than 5 to 10% in a short period, in 3 months. If somebody has lost 5 to 10% body weight unintentionally, then you have to think about, there are so many other reasons. Even diabetes could be a reason, but stomach cancer, we should think about that. The second is loss of appetite. You don't feel like eating. Most of the old people, they say, so this is because of the age. I don't eat, I don't feel like eating, that is why I'm losing weight. So that is one factor, but that is not always. So always look into that and rule out these things. So the next is sometimes they present with anemia because of the tumor encroaching, bone marrow suppression. They can get anemia because of loss of appetite, and this thing, probably they nutrition deficiency can cause anemia, bleeding, blood vomiting, black color motion, that can lead to and present as anemia. Anyone around 45 years comes as anemia, we should think about all those things. Sometimes they feel, this patient themselves, they can feel swelling in the this epigastric region. They can palpate. These are, so these are the signs and symptoms of cancer stomach. If you have any of these things, if not all loss of appetite, not all weight loss, but if you have, it's a prolonged, if you have a suspicion, then it's better to evaluate. So how to diagnose cancer, how to know it's a cancer? Of course, you have to go to the doctor. He will ask some questions and he will examine you physically. So you may have a pain or even some mass swelling, anything here, or even sometimes in the neck you have a lymph nodes, the swelling. So these are all can make the doctor to think about, okay, this candidate may have a cancer. Like you have a jaundice, you have a anemia, you are a smoker, you are obese. Plus these findings can go to the next level of investigations like or ultrasound abdomen, CT abdomen. These are all the simple tests, initial tests. And very importantly, 100% one test or one investigations to rely on is endoscopy. So the endoscopy goes in and sees whether it's a simple ulcer or it's a tumor or there's bleeding. All these things is one part. And mainly when we do endoscopy, we can take a biopsy. So biopsy taken, sent for biopsy, and the report comes if it is cancer. Then the next level is stage of the disease. Stage 0, 1, 2, 3, 4. 0 is very early. 4 is full blown cancer stomach, and each stage plus the site of the cancer, like it's at the foot pipe and stomach junction, upper part of the stomach, middle part of the stomach, and the lower part of the stomach. The treatment varies. The treatment, first treatment is always surgery, surgical excision, followed by chemotherapy or even sometimes radiotherapy, all included. So surgery followed by chemotherapy or radiotherapy is very important. And how to reduce your risk? Very simple: reduce your weight, take more vegetables and fruits, and go for exercise. These are the things which can reduce the risk factors for the stomach. Certain risk factors cannot be reduced by your gene, all these things, but quitting smoking and alcohol, definitely at least 3 times the risk factor comes down. So these are the signs and symptoms. And if you have any of these things, simply if you're more than 40-45 years, weight loss, loss of appetite, anemia, then go to the doctor immediately and do an endoscopy. Thank you.